So right now Abby is putting on the sleeve or the sock. That's the white piece that you see her holding onto Winter's peduncle. So Winter has the long portion of the dolphin's tail. So if you look at the dolphin's tail, they have that dorsal fin on their back, then they have the really long part that goes all the way down, and then they have those two triangular fins at the very end, and those fins are called the flukes. And that's the part that Winter does not have. So Winter was found whenever she was about 2 months old as well, and she was found in about the same location as Hope, near Cape Canaveral on the other coast of Florida. They were both found in the month of December. In fact, Hope over here was rescued exactly 5 years and 1 day after Winter was rescued. And Winter over here was found entangled in the ropes of a crab trap. So she had the rope wrapped very tightly all around her body and in her mouth and also around her tail area. So basically, the rope had wrapped so tightly around Winter's tail that it cut off the blood circulation to those flukes, those two fins at the end. So if you've ever taken a rubber band and wrapped it around your finger will start to turn purple, and that's because you've cut off blood flow to that area. And if you leave it that way for a long period of time, the tissue in that area will begin to die. So Winter's tissue in her tail began to die and slowly fall away from her body. So most of her tail actually came off by itself. But we did make a small surgical procedure once it reached a certain point, because Winter had not only lost her tail flukes, but she also lost several of the vertebrae in her spine. Those are the bones in the spine. So Winter now just uses her peduncle. She does swim in more of a side-to-side motion, kind of like a fish or like a shark swims. And whenever she uses the prosthetic tail, she has been able to move in more of an up and down motion like other dolphins. So a company called Hanger Clinic had learned about Winter, and they called the aquarium and they offered to build her very own prosthetic tail. So Winter has gone through many different tails. As she gets older and larger, we make more and more tails to better fit her body and make more efficient for her to use. So that's what they're doing right now, is placing on that final piece of the tail, and they just strap it on with that Velcro strap that Abby has in her hands. And we just monitor her very closely to make sure that she's using her tail in an up and down motion. Now, she doesn't use her tail all the time. She doesn't use it 24 hours a day, 7 days a week. So how many of you guys go to the gym or work out? One of you? It's okay. It's a no judgment zone. So for you that goes to gym, you might notice that if you were to lift weights, it's going to put strain on your muscles, which is a really good strain because it's going to help to build your muscle and it's going to make you stronger. Well, if you were to lift weights for 24 hours a day, 7 days a week, it's going to eventually make your muscles really, really sore. Because at that point, you are overworking your muscles. You're overdoing it a little bit. So in winter, we use the tail with her, but we don't use it for 24 hours a day. So we put it on and we let her use it for a few minutes. We might use it for 20 minutes, we might use it for 5 minutes, we might use it for 10 minutes. It's always different. It's never on a set schedule. And it just depends on her goals for the day, as well as what our veterinarian tells us and consults with us. So Winter does use her tail, but she doesn't use it all day, every day. So we just want to keep things different for her, as well as make sure that she's using it appropriately and taking breaks throughout the day as well. And the tail actually helps her to work out those up and down muscles that she doesn't normally get the chance to use. So it's not necessarily to help her swim, but it is to help to build muscle in that area and prevent any curvature in her spine or in her body. Because if you look at Winter, you'll probably notice that her tail does curve down just a little bit. So we want to make sure that we're preventing any further curvature in her spine. So that's going to help her during her physical therapy sessions. We don't always work on physical therapy. Winter gets other sessions, just like our other dolphins. You do play sessions, that's just for fun. We do husbandry sessions, which are more focused on medical management and taking care of the animals. All of our animals are voluntarily trained to give us samples. Those samples can include blood, urine, fecal, and gastric samples, which is the fluid in the stomach. We can also collect blowhole cultures from our dolphins, so they do have a hole on the top of their head that they breathe from. And we can actually collect their breath in a dish and send it to the lab and test it to make sure that their lungs and their respiratory system are nice and healthy. So everything that we do with our animals is voluntary, and sometimes they don't want to participate in the training session. That's okay. We just usually wait a few seconds, we try it again, and then we move on to something else. So with our animals, we use positive reinforcement. So you'll notice that Sue and Emily over here have whistles around their neck, and so does Abby over there with Winter. And whenever the dolphin completes the correct behavior, we blow the whistle, and that lets them know that they can go ahead and stop what they're doing and return to their trainer for their reward or reinforcement. Now for Panama, we do have to accommodate to her because she cannot hear. So you will notice that Emily does not use her whistle with Panama, but instead she may point at Panama with her finger, or she may tap her with her hand to let her know that she's done the correct behavior. And that's how we do training with Panama. So we want to make sure that we are maintaining that positive relationship with our animals. So they do make mistakes sometimes, and they do get confused, and that's okay. No one is perfect. So if they do make a mistake, we just, like I said, wait a few seconds, and we might try that behavior again, or we could just move on to a different behavior and come back to that session later on in the day. So that's something that we have thought that actually improves our training session, and it makes